The first time I realized I had anxiety was New Year's Eve of 2020. It was one of the worst experiences of my life. I'll never forget. It was gonna hit midnight. It was me and my boyfriend at the time. We had went to college from high school together. We had just moved to Los Angeles just a few months before. And so we're living not in the best part of the city. We're in our apartment and we're gearing up for midnight. And once midnight hit, right outside of our window, shotgun. Like, the sound, I mean, I can't even recreate it. Of course, not with my mouth, but it was so loud. I started going into a panic attack. It was my first panic attack, however, so I didn't know what was happening. I thought I was gonna die. I kept saying, I'm gonna die, I'm gonna die, I'm gonna die, I'm gonna die, I'm gonna die. I said that over and over again. That's probably what I remember the most. And then it passed by. It maybe lasted 30 seconds, a minute, maybe not even a minute. But it forever changed my life because my anxiety started coming out after that moment.
Have you ever noticed anxiety in your children? Do they have anxiety? Have they ever felt an anxious moment? If they did, would you even know what to look for? If you're a parent that has ever thought about anxiety in their children or have anxiety themselves and worry about transferring over to their kids, I have an ebook for you. My ebook will help you to recognize the signs and symptoms of what to look for, as well as helping with prevention and treatment. My name is Dr. Chandra Smallwood. I'm a psychiatric pharmacist and a confidence coach and a mom. Click below. You'll love the information. Click below if you want to help your child manage anxiety or anxious symptoms.
So in this video today, I would just like to talk about anxiety and its causes. Just a basic understanding of anxiety. So what is anxiety? If you've ever seen the movie Inside Out, Inside Out 2 brings anxiety and a couple other characters that come with anxiety, but anxiety is a new character. He or she, I don't know if it even has a gender, is super cute, and the child has kind of grown up, well, not grown up, but gotten into her teenage years, and anxiety has stepped in. Anxiety is a normal human emotion characterized by feelings of worry, fear, and unease. It's a normal response to stress. However, at times it can become excessive, and we can start feeling anxiety every day. We should feel anxiety when we are threatened, when there are times where we need to defend ourselves, or there are times when we want to level up in this world. When we are stressed or threatened, anxiety will begin. It usually turns on our sympathetic nervous system. Our sympathetic nervous system is our fight, flight, or freeze. So this is in survival since the beginning of time. Man, we've had the sympathetic nervous system. It's a part of, it's a branch off of the central nervous system, part of the autonomic nervous system, which are things that just happen automatically. We don't really control them. So the sympathetic nervous system turns on, and then we start feeling the physical effects of anxiety. This usually lasts for the time that there's the threat, and then it goes away. So this is healthy. Anxiety, for the most part, is a healthy human emotion, just like everything else, even sadness, even though sadness feels not so healthy at times. It's normal until it's not. When you have anxiety daily for over 6 months, it's characterized as an anxiety disorder. And anxiety disorder can stay with a person for a while. It's something that can be healed from. However, it takes a lot of time, a lot of effort, a lot of work. Sometimes people need medication, sometimes they need therapy, sometimes they need both. It's recommended to do both. So back to the sympathetic nervous system. The sympathetic nervous system is a physiological response to stress. It's our body getting geared up to fight for ourselves, to remove ourselves, and then sometimes to freeze, even though we hope not to freeze if a saber-toothed tiger was coming at us. I know, random example. What happens is we get a threat. The amygdala of our brain goes off, says, hey, there's something wrong. There's something chasing us. There's something in our house. Something is happening. All of a sudden, brain chemicals start going and moving, and then hormones become activated, and then we become like a superhuman. The sympathetic nervous system it's like when women can push a car because their baby is underneath or something like that. It's like it makes you really strong. It makes your eyesight better, it makes your hearing better, it makes you able to survive or to do what needs to be done to level up in this world. That's why we feel anxiety when we want stuff, such as like a new job or a promotion, or to do something to make that you're gonna make a lot of money. Anxiety starts kicking in. Like I said earlier, when it becomes dysregulated, we have an anxiety disorder. So let's talk about the different types of anxiety disorders. Because anxiety is healthy. We get it. Everyone gets it. It goes away. Not everyone will end up with an anxiety disorder from having anxiety. So for the ones who do, such as myself, I've had an anxiety disorder many years ago for a very long time. I, however, do not have it anymore. I do still get anxiety, of course. But it's not as often because I've dealt with it for so long. I kind of know the ins and outs of it. And that's why I'm here, to teach and help others. But however, I still get anxiety at times, and it's normal. But I just process it so it doesn't get into an anxiety, so it doesn't turn into an anxiety disorder. It no longer scares me. Sometimes people get into the loop of they get anxiety, then they're scared of getting anxiety, then they're scared, so they're scared of something else that just keeps going. I'm not scared of getting anxiety. I'm not scared of when I have it, what it is. I just know that when it comes, there's things that I need to do in my life to fix it so it can decrease. But let's talk about different types of anxiety disorders. Probably one of the most common, they're all pretty common. Anxiety is the most diagnosed mental health disorder in America, maybe even the world. I'm not sure, but I know in America. And you could say the most basic is generalized anxiety disorder. That's when you just have anxiety all the time. When I had anxiety disorder, I had generalized anxiety disorder with panic disorder. Because I had more than one at the same time. So when I had generalized anxiety disorder, I felt stuck a lot. Like I couldn't really move. And as well as feeling stuck, I had a lot of chest tightness and back tightness. So it always felt like I lifted the most heaviest weights. And I love to go to the gym, so sometimes I wouldn't know the difference. Like, did I do too many chest exercises or am I having anxiety right now? But it made me feel like I couldn't be productive. Like I couldn't do anything all day. And that was very hard for me, especially when you have to go to work and you just have to front and fight through it. So when you have generalized anxiety disorder, you're just worrying every day about everything, all sorts of things. What's happening, what people are thinking, are you doing the right things? Are you going to get this done? Is something going to ruin your day? Like you're just thinking about things all day. Worrying all day makes you very tired. Very tired. It's hard to think about the things that you really need to do and get done. It's hard to concentrate because you're worrying about something. You can't be the best you can be when you have generalized anxiety disorder. Next, panic disorder. Panic disorder feels like how I described at the beginning, like I'm gonna die. Like you have the feeling of impending doom. That's what it's called. Like, you feel like you're gonna die. And that was one of the first terms I learned about anxiety, because I Googled or something, when you feel like you're gonna die, and it came up, the feeling of impending doom. And it was like, whoa, like, that sounds crazy. It can be very fast. It feels, to me, it feels like a rise. It feels like all of a sudden my heart is beating, and it's beating faster, and it's beating faster, and it's beating faster. And then it kind of like hits a plateau, and then it comes down. But when it goes up to that plateau, it feels like, what's going to happen when it reaches that high point? Usually it reaches that high point, and then it goes down. But you may have a lot of, rapid heart beat. You may tremble. You may feel like shaky. You may be sweaty. It's very intense. Afterwards, you feel very tired. You may feel tired for 2 to 3 days afterwards, because it's such an intense feeling for your body. I struggled with a lot of fear of panic attacks when I had them. I would get them in my sleep. I started to get them at restaurants. Once I was on vacation in the Dominican Republic, and I had one after I went to the gym. All of that was probably, that's not the most recent one, but that one was very significant for me because I was on vacation and I wasn't necessarily stressed about anything, but there was something in my life that I wasn't taking care of, and it came out at that time. Panic disorder can sometimes also come with social anxiety disorder. For a short period of time, when I was out at restaurants, I would get panic attacks. I attribute it to social anxiety because for some reason, when I was just out and about, I would just feel the increased stress, worry, fear. A lot of people that have intense fear of social situations or social anxiety will say, I don't like to be around other people. Like, they may say they don't feel normal around other people, or they don't like people, or everyone is looking at them, and for that reason they don't want to be around others. These people tend to want to just stay home. They may have trouble talking with others. They may blush a lot. They may get really hot and sweaty because they're so nervous. Social anxiety disorder is very common, and it's really something that you have to be aware of and want to work on in order for it to go away. Next are specific phobias. Specific phobias are, if you know what phobia means, exactly what it sounds like. You're scared of something. Spiders, ants, airplanes, anything. You're scared of it, but it's irrational. Like, you feel like if you see a spider, that spider is going to jump off the wall, come to you, bite you. You're going to have to go to the hospital. You might die. You'll leave your kids. Like, this is what happens when you have these specific phobias. It's very intense, very frightening. One specific phobia that people are very familiar with is claustrophobia, being in small enclosed spaces. When it comes to phobias, exposure therapy is probably all that we can do. Exposure therapy is, you just gotta put yourself in that situation over and over and over again until it gets better. You can lead up to it, minutes to hours, but yeah, it's kind of like what it is, which is a lot, but it works. Next is obsessive compulsive disorder. You may have a lot of obsessions, which are unwanted thoughts, or compulsions, which are repetitive behaviors. OCD can interfere with your life because it stops you from doing a lot of things. Like, you have to, check the door 227 times before you go to bed. If you're not able to complete these traditions or compulsions, then you cannot continue to move forward with your day. And if you think about the unpredictability of life, that is very troublesome. Next is separation anxiety. And a lot of times that happens with children. After they get to a certain age, there's a time when they realize when you walk out the room, they don't know when you're coming back. Like kids they don't know. They don't know what's happening. They just know mom or dad has left the building. I don't know when they're coming back. I'm gonna cry now. Separation anxiety is not being able to really function very well, clearly think. You may feel stuck again without being with that individual or even with that item. Because sometimes people, like you may see people who have, like kids have blankets, they have dolls, they have bears, and they feel that comfort with that thing or person, and when it goes away, they can't find that comfort in the moment. Health anxiety is a form of anxiety that is an anxiety disorder that I wouldn't say is new. It's been around actually forever. It's the same thing as you calling someone a hypochondriac. They always think everything that is happening to them, that means that they're sick. They have a headache, they have cancer. They have a sore throat, they have cancer. They have anxiety, they're having a heart attack, they're gonna die, they're gonna have a stroke. Next, we have agoraphobia. Agoraphobia is a fear of situations or places that might cause panic, helplessness, or embarrassment. And people tend to want to avoid these places. These individuals may avoid public transportation, crowds. They may just not want to leave their house in general. These are the people who may stay in their house for weeks and weeks and weeks. They have agoraphobia of anything. They may just have agoraphobia about leaving their homes. Agoraphobia may start after someone has a panic attack somewhere because they're scared of having another panic attack. There's that theme of anxiety causes fear of more anxiety causes fear of more anxiety. Same with panic attacks. Panic attack causes fear of panic attack. And last but not least, in what I'm going to mention, is selective mutism. This may happen in kids more than it happens in adults. It's a time where basically what it says, like, there's some reason you don't want to talk. These are people who can talk and do talk. They just don't talk in certain situations, such as school or social situations. Maybe they won't speak up at work. Like at meetings, they're just like, they're mute. They don't want to talk. They're nervous. These people can speak freely in regular settings in their home or with family members, but not really with strangers. As you can imagine, this can significantly affect someone's life because there's many situations all the time where we need to speak up. You know, we need to be able to say, like, if you want to move up in your job, you may have to give a plan for something. You may have to manage a project. If you cannot do these things, then you're not going to be able to get a promotion. These are some of the main, most common types of anxiety. There are other types of anxiety as well, but this is the meat and potatoes of it. So causes of anxiety. Some causes of anxiety can be biological, such as genetic or family history or environmental. So there are actually genes in our body that will make someone more susceptible to anxiety than someone else. You're born with that. There's nothing you can do about your genes. You just have to work a little harder to decrease anxiety more than someone else, or to control the anxiety. Family history plays a big part because if you're around someone all the time, like a parent who has anxiety, you're gonna kind of learn from them how to have anxiety, and it becomes a part of your life because they're so close to you, and you may be in the same space with them often, and you see how they react to certain situations, and it just becomes familiar to you. An environmental factor of anxiety would to not have a parent that has anxiety, but maybe their parenting style gives you anxiety. Like, maybe they want you to be perfect all the time, or you're not in a safe space at home, to where you can talk about your feelings or anything like that, and you develop a fear of maybe saying something about how you feel, or a fear of feeling a certain type of way, or fear that you're not going to be able to meet their expectations. These things can significantly contribute to anxiety. These are things that when we start having anxiety, like when I started having anxiety, I didn't really go into know why I had anxiety, or didn't know anything about where to look. Like, I didn't even think about looking at my past at that point. Like, now I've been there, done that, and I'm still doing it. But when it first happened to me, I was kind of like, well, what's happening? What's wrong with me now? So for some people that have anxiety, they don't think about the long-term effects of anxiety. They don't think about, their parent or their parent's parenting style, because they really have nothing to compare it to. Like, if you don't know much about anxiety, you don't realize that your parent is anxious. You don't realize that the things that they say to you and do to you, or the way they raise you, is going to cause anxiety, because you have nothing to compare it to. You have grown up the way you've grown up. For you, it's your normal, even if it's a very anxious normal. There are also neurotransmitter imbalances, and this may happen for all sorts of various reasons. So the neurotransmitters that tend to affect us and cause anxiety, and a lot of times depression as well, they kind of do run hand in hand, even though they're very different from each other, are serotonin, dopamine, norepinephrine, GABA, and thyroid hormone. Thyroid hormone may sound like it doesn't fit in with the rest of these, but hyperthyroidism, because the thyroid regulates your metabolism. So when you have hyperthyroidism, everything is sped up. And when it's sped up, I kind of describe it as having a whole bunch of caffeine all the time, or you're just like downing Red Bulls all the time. It can cause anxiety because you're always stimulated. So you're stimulated before, like, there's the threat, or there's the wanting to advance. So then it kind of piles on top of each other. There are also many physiological factors when it comes to stress. We could stress about a lot of things, but let's talk about something that's pretty common, which say money, finances. If you can't afford life, then you're gonna be stressed. And if you're stressed every day because you can't afford life every day, it may turn into an anxiety disorder, because your body is feeling threatened all the time, and your sympathetic nervous system is constantly shooting out hormones. And these hormones are telling your body that there's a threat, I need to fight it off. And it keeps you up and stimulated and ready to fight all the time. Like, think about just sitting on the couch and your body is feeling like there's a lion about to eat you. Like, that's very uncomfortable. When we are stuck in negative feelings or thoughts, a lot of the time, we feel like we can't, do anything, or we're not worthy, we're not smart enough, we're not pretty enough. We're just not enough of something. We get anxiety because we worry and we're scared. And a lot of times people don't want to talk about these things. They don't want to seem, they don't have confidence. They lack the love for themselves that they would like to have sometimes. This is very common. From talking to patients, this to me is one of the major causes of anxiety. But a lot of times it starts when a person is young, and it just kind of keeps going. And we have to, in order to heal, like, we have to stop it from continuing to happen in our lives. And that can be very difficult and takes a lot of time and a lot of effort. Like, you have to you're committed to yourself to do something like that. But it can be done. You can do it. This is a lot harder when you grow up with something traumatic. There are people who have been molested or sexually taken advantage of, as young children. Like, how do you get over that? If your parent touched you in an uncomfortable way, how do you ever let that go? That's super difficult. I can't even say that I can, understand that, because that's something that traumatic has never happened to me. But I talk to people that's happened to, and they want to move on with their lives. We all do. But we have to look back, and unfortunately, we have to heal our inner child. Like, we have to take care of those things from the past. And for some people, it seems like such an impossible feat. But they do it. They do it because they have to do it. They do it because that's the only way they can be there for their kids. Usually they have a why. They have loved ones. They have someone that is pushing them through. And so they work on it. And it's not easy, not even close. But it's a consistent practice. We have to be consistent every day. There are a lot of environmental factors that cause anxiety, especially right now. The election is happening. People are nervous. The difference between Democrats and Republicans seems like rich versus poor, black versus white, or black and brown versus white. It all feels very, very negative. Like, I had a patient the other day who said he went to drop off his ballot and they were intimidating people dropping off their ballots at the ballot box. Like, could you imagine? Where you live, you may feel some kind of racial hostility. You may feel uncomfortable. As a woman, you may feel like you're being sexually harassed or intimidated by a man. A man could feel the same way from a woman or a man. Depending on, your sexuality, where you live, may cause anxiety depending on how people treat you or what it's like to walk outside and the things you see every day. Such as the news. The news is a big environmental factor that affects people and their mental health. We need to be careful about what we let into our mind and our body. So as you can see, there's a lot of different intersecting subjects that can cause anxiety. It could happen genetically, to our environment, to how we were raised, to what happened yesterday, to what's on the news. There are many types of anxiety: generalized anxiety disorder, panic disorder, separation anxiety, social anxiety, agoraphobia, health anxiety, obsessive compulsive disorder, selective mutism, all different amounts of worry and fear. We have neurotransmitters in our brain that are consistently up and down that control the way we feel based on an input that we receive. Anxiety is a normal human emotion. However, if we're not careful at times, it can turn into a disorder, especially for someone who is more liable to get it, depending on their environment or their genetics. My name is Dr. Chandra Smallwood. I'm a psychiatric pharmacist, anxiety survivor, mother, and if you have any questions, please let me know. Please subscribe, share, or like this video, or more videos to come. I want to spread awareness about anxiety in order to decrease the diagnosis of it, because it's increasing out of control.